Hello everyone. January is known for the month of cervical cancer awareness, and on this occasion, I'd like to discuss a few things about cervical cancer. Firstly, what is cervical cancer? The human womb or the uterus has a opening or a mouth which is called as the cervix. Cancer affecting this part is known as cervical cancer. What are the symptoms or signs of cervical cancer? Commonest symptoms and signs are any kind of bleeding or discharge from the vagina. This is an abnormal bleeding or an abnormal discharge, meaning it can anything that occurs in a post-menopausal woman, a woman who has stopped menstruating. Any kind of bleeding or discharge is an ominous sign, and she must consult a doctor to rule out cervical or endometrial cancer. In women who are still menstruating, any abnormal bleeding is bleeding in between cycles or any kind of discharge, pain after sexual intercourse, lower pelvic pain especially. These can be signs of cervical cancer, and one must consult your doctor to get yourself tested. So what are the risk factors that can cause cervical cancer? What is the cause of cervical cancer? Cervical cancer is mainly caused by a virus called as human papillomavirus or HPV. There are various strains of HPV, and a few strains of these can cause cervical cancer. How do you get infected? Infection with HPV is via sexual intercourse. So early age at onset of sexual intercourse, or having multiple sexual partners, or a husband or your partner having multiple sexual partners. These can all put you at risk for developing cervical cancer. Also, having poor genital hygiene or having infections like STDs or sexually transmitted diseases also increases the risk of developing cervical cancer. Some immunosuppression, like if patients who are on treatment for organ transplant or on drugs which reduce their immunity, patients infected with HIV who don't have adequate control also can increase the risk of developing cervical cancer. So how can I protect myself from getting cervical cancer? One way to prevent it is by adopting safe sex practices like using barrier contraception like condoms, etc. And trying to avoid multiple sexual partners, maintaining female hygiene, getting yourself treated immediately if there is any kind of infection in the cervical or the vaginal area. These are the ways in which we can try to prevent getting cervical cancer. Additionally, we can also try screening methods. Screening is basically when we are trying to look for cancer without having any symptoms of cancer present in the body. How do we do that for cervical cancer? Is a simple test called Pap Smear. What is done is few cells are taken from the cervix and they are examined under the microscope, and we are looking especially for abnormal cells. So this test can actually detect even precancerous lesions. So even before the cervical cancer is formed, whatever abnormalities are there, we can detect it even at that stage, and it can be totally prevented. Doing a Pap smear once every 3 years, or if you accompany it with an HPV test, we can do it even once every 5 years, is recommended for women about the age of 30 years or at least 3 to 4 years after the onset of sexual activity, to be done at least till age of 65 or 70 years. And if your last 3 tests have been negative, then we can stop doing the screening or Pap smear test for cervical cancer. In addition, if there is any abnormality, then we can do additional tests like colposcopy or a biopsy to know if there is any other abnormality or a change in the cervix. A little bit about cervical cancer vaccination. So a lot of people ask me that is vaccine good for the kid? Will it prevent cervical cancer? So like we discussed in the beginning that cervical cancer can be caused by many strains of HPV. The current vaccines which are available look at least 4 strains, which are the quadrivalent vaccines. Although they can protect you to 70 to 80%, but they are not 100% protective, which means that even if you take a vaccine, there may be few strains which can still cause cervical cancer and you may be infected with them. So one must still continue to undergo a Pap smear testing even if you are vaccinated. What is the treatment for cervical cancer? If it is caught in early stages, a surgery is enough, removing the uterus, the lymph nodes and the cervix. In case if it is a little advanced, then one may have to give radiation along with chemotherapy. In very advanced stages, we have to give, the intention of treatment becomes palliative or only control, in which case treatment with chemotherapy or targeted drug can be offered.